Hey gang, Unitic here. It is Halloween and I'm finishing my last day in Shenandoah National Forest, and I wanted to record a relatively short video that I've been thinking about a lot. I'm going to call it Lyme Myths Busted, and I'm going to try and record this video before I get rained on here because I think I'm going to get wet today. But I am going to town. Going to Waynesboro after covering 131 miles in the last 7 days. Been out on the trail for 8 days straight after a great visit with some trail angels, the Wheaton family, up near Harper's Ferry, and my friends Ethan and Katie Bean. Hey gang. But now I'm going into Waynesboro. I'm gonna splurge and get an inexpensive motel. Only the third time I've done that now in the 3.5 months I've been on the trail. And eat, clean up, do laundry, resupply, and I'll be back out on the trail tomorrow, heading further into Virginia. So Lyme Myths Busted. If you've watched any of my other videos, you've heard me talk about several of these topics, but I wanted to do this kind of an all-one short video that you could share with others. Number one myth I want to bust, that quite frankly was the number one reason that I got infected and wound up with chronic Lyme, yes it does exist, is that a tick needs to be attached for, you'll hear, anywhere from 24 to 48 hours in order to pass enough of the bacteria to make you sick. That quote unquote there's very little chance you're going to get Lyme or one of the many other cruddy pathogens these ticks carry in less than 24 hours. Busted. Not true. I'd heard that for years. I've heard it in hiker groups and official literature, public health organizations. Honestly, I've still seen it on posters out here on the Appalachian Trail. And I'm thrilled to say I've met some great folks at the Appalachian Trail Conference, Lori in particular, at the ATC office in West Virginia, and we're going to take a look at some of the information that's not based on science that could be getting people sick unnecessarily. That being, in my mind, the number one preventative myth that needs to be busted. And if you dig into it like I did, when I had no other alternative, because I was spending the better part of a year on a couch after I'd gut out a day of work doing research, you'll find that there is no definitive study that that myth is based upon. And if you want more details, you can watch my ALDA, American Long Distance Hikers Association, number 2, the longer video where I go into some detail about why that myth came about and why it seems to persist. The truth is, the longer the tick is attached, yes, the higher the risk you're going to get sick. But you can get sick in a lot less than 24 hours. So take it seriously. Seek treatment from a well-informed physician. If you believe you've had one of these ticks, particularly blackleg tick, deer tick, and soon to be confirmed Lone Star tick that is known to carry Lyme disease, visit a doctor that gives you a clinical diagnosis. Another myth busted, that there is an effective Lyme lab test, blood test, where you can get a quick answer whether you've got Lyme. If you watch another video of mine, Why a Whistleblower, Lyme Truth, Why a Whistleblower, you'll hear me talk in detail about why the current lab tests are so poor in fact that the state I'm passing through right now, Virginia, just signed into law in July. The Lyme Test Disclosure Act of 2013 mandates doctors who give either of these substandard lab tests, blood tests, the ELISA or the Western blot, have to give a written disclosure statement to their patients, clearly telling them that even if this test comes back negative or is interpreted as being negative, is a more accurate statement because it's not a pass-fail. It takes interpretation. Just because it's negative doesn't mean you don't have Lyme. There are hundreds of thousands of people, if not millions, infected with Lyme disease to this day that have been walking around for years thinking they're Lyme-free and that their symptoms are all due to something else. It's really a tragedy. So you visit a doctor, make sure that they give you as a primary diagnostic tool a clinical examination, inventorying your symptoms and the timing of their appearance, your medical history, those kinds of things. And then they can give you a lab test that could confirm a clinical diagnosis, but not rule out Lyme. Very important. So those are two myths that have to do with prevention and early intervention. Another one that's out there, I've actually had hikers ask me this question. It's a ludicrous myth that has been put out through the years by various public health organizations, and you still have doctors that think this is true. That after a tick bite, a single 100 milligram dose of doxycycline will wipe out the infection if taken immediately after the bite. What a load of baloney. If you get a doctor suggesting that to you, I'd like you to ask him or her to name two other, maybe even one other, bacteriological infection that is eradicated through a single dose of any antibiotic. It's just not true. So know that and be safe. So lastly, you know, those are two key ones. Let's talk about the bullseye rash and rashes in general. Really, really important information here. Perhaps as few as 50% of the people that do contract Lyme, and usually if you've got Lyme, you've probably got one of many co-infections that may go along with it from these ticks, that as few as 50% of the people get a rash, period. And not all of those rashes are bullseye. A bullseye is an indicator you should be treated immediately for Lyme. Don't wait on the tests. Get treatment into your system while the bacteria is still in your bloodstream before it drills into your tissues and organs. Bullseye, definitely. Treat. An expanding red rash is another version of a Lyme rash. It's what I had, but it wasn't a bullseye, and it was actually in a place that I couldn't see it unless I looked with a mirror. Very common. Many people never recall being bit by the tiny deer tick nymphs, much less spot the rash if it's under your hairline, your groin, your armpit. But the rash is expanding red rash or a bullseye is an indicator of immediate treatment. But don't feel in the clear if you don't get the rash. The rash can appear weeks later. By that time, that bacteria can spread all throughout your system, out of the bloodstream, into your tissues and organs. Much harder to treat. So the key is know the ticks, know how you can be bitten, know where they live, know how the process works and when symptoms occur, and be an informed patient. You know, find a doctor that's self-assured enough that they're not intimidated by learning from a patient. You know, I want a doctor that's a lifelong learner, open-minded, and realizing that great information, new information can come from any source, not just the AMA, the CDC, and the IDSA and other official channels. So, if you don't have a doctor like that, or you visit one that projects, not uncommon, arrogance, condescension, I wouldn't call these doctors in the majority. Vast majority of doctors, medical practitioners in general, are wonderful people with compassion, empathy, open-mindedness. But there are others out there that run as fast as you can if you encounter them and find one of the aforementioned types. So those are some key myths. And lastly, I'll mention the myth that Lyme is always eradicated by 2 weeks, 10 days, 2 weeks of doxycycline. And then if you continue to have all the symptoms after that course of antibiotics, no matter how long the infection has been in your body, years in cases, you're miraculously cured of Lyme disease. You have something that the IDSA has coined post-Lyme syndrome, a name for a syndrome that's totally unexplained by them, including any kind of a treatment for it other than symptom care through drugs for perhaps the rest of your life. You know, it's just ludicrous. And yeah, I'm pretty adamant about that position. I've done the work, I've experienced it firsthand, and I've connected with countless Lyme patients. You know, it's the fastest growing epidemic in the United States, again, if not the world. Multiple strains of these infections going around. And there's so many people sick with them that these myths just get sillier every day as people find out the truth, unfortunately firsthand. So let's not have that happen to you. For today, I'm going to sign off. Hear me out of breath here as I'm going up and down mountains, doing 20 miles today. And may need to get my rain jacket on really quick. But those are some of the myths I wanted to bust. Please feel free to pass this video along. Thanks for all your support. I got less than 900 miles to go and just about 2 months left on the trail. What comes next, I do not know. I think I'll do a video about that at the hotel tonight. Maybe you guys can help me with that. For now, this is Unitic signing off. Happy Halloween.